Pediatric abusive head trauma is a critical issue in child welfare, and understanding it is crucial for those working with vulnerable populations. This episode complements the course offered by therapy trainings, providing essential insights into recognizing and addressing this form of abuse. We will discuss the signs and symptoms, the impact on children, and strategies for intervention and prevention. This knowledge is vital for counselors, therapists, and mental health professionals dedicated to protecting and supporting at-risk children. So what can you expect to learn in this episode? We will cover the background of pediatric abusive head trauma, identify risk factors, distinguish between accidental and abusive head trauma, explore prevention measures and treatments, and discuss the necessary steps to report child abuse and neglect in Kentucky. We will also touch on some common misconceptions and provide thought-provoking insights to encourage you to think critically about this topic. Let's start with the background of pediatric abusive head trauma. This type of trauma is a significant cause of injury and death in infants and young children. It often occurs in the context of child abuse, where caregivers might use excessive force or engage in behaviors that lead to serious head injuries. The statistics surrounding this issue are alarming. According to data, abusive head trauma accounts for a substantial number of hospital admissions related to head injuries in children under the age of 2. Now, why is this such a pressing issue? Well, infant brains are still developing, making them particularly susceptible to injury. The violent shaking or impact can lead to serious consequences such as bleeding in the brain, retinal hemorrhages, and even death. More importantly, these injuries often go unnoticed or are misdiagnosed, leading to further trauma and risk for the child. One of the most crucial aspects of this course is understanding the risk factors associated with abusive head trauma. It's essential to recognize that certain environments and familial situations increase the likelihood of abuse. For example, children living in households with a history of domestic violence, substance abuse, or mental health issues are at a higher risk. Additionally, young, inexperienced caregivers may not have the coping skills necessary to manage the stress that can arise from caring for infants and toddlers. So how do we distinguish between accidental and abusive head trauma? This is a critical skill for professionals in the field. Accidental head trauma often occurs during typical childhood activities. Think of a toddler falling off a bike or bumping their head while playing. In contrast, abusive head trauma usually involves indicators such as multiple injuries at different healing stages, unusual patterns of bruising, or injuries that don't match the explanation given by the caregiver. It's vital to approach this with both compassion and a critical eye. When evaluating a situation, ask yourself, does the explanation provided by the caregiver align with the physical evidence? Are there discrepancies that warrant further investigation? Now that we've covered the basics, let's shift gears and talk about prevention measures and treatment. As mental health professionals, we carry a unique responsibility to not only treat, but also to prevent these tragedies. Education plays a vital role here. Caregivers need to be informed about the potential dangers of shaking a child, the importance of calming techniques, and the resources available for parents in distress. Programs and workshops focused on parenting skills can provide invaluable support. They can teach stress management techniques, effective communication strategies, and how to seek help when overwhelmed. Additionally, creating a strong community network can aid in prevention. When families feel supported and connected to community resources, the likelihood of abuse decreases. In terms of treatment, early intervention is critical. If a child presents with signs of abusive head trauma, immediate medical evaluation is essential to address any injuries and mitigate long-term consequences. Following medical treatment, psychological support for the child and their family should also be prioritized. Therapy can help families process the trauma, learn coping strategies, and rebuild relationships that may have been impacted by the crisis. Now, let's discuss an important aspect of this topic, reporting child abuse and neglect, particularly in Kentucky. It's crucial for mental health professionals to be familiar with the legal obligations surrounding reporting. In Kentucky, any professional who suspects child abuse or neglect is mandated to report it. This includes doctors, nurses, teachers, and of course, mental health professionals. When you suspect abuse, it's important to document your observations carefully and report them to the appropriate authorities. Kentucky's Child Protection Hotline is a resource that can guide you through the reporting process. Remember, your role is not to investigate, but to report suspicions based on your professional observations. As we continue through this podcast, let's take a moment to address some common misconceptions regarding pediatric abusive head trauma. One prevalent myth is that abusive head trauma can only occur in extreme cases of violence. In reality, even seemingly minor actions like shaking a child in frustration can lead to devastating consequences. Another misconception is that abuse only happens in certain socioeconomic classes. The truth is, abusive head trauma can occur in any household, regardless of income level, education, or background. It's a reminder that we must remain vigilant and compassionate in our work and avoid making assumptions based on appearances or stereotypes. Now that we've covered these key points and misconceptions, let's reflect on why this knowledge is so important. Every child deserves a safe and nurturing environment, free from harm. By understanding the complexities of pediatric abusive head trauma, we can better support families and advocate for the well-being of children. As mental health professionals, it's essential to recognize the signs of abuse and to be proactive in prevention and intervention efforts. We have the potential to make a significant difference in the lives of families and children who may be facing unimaginable challenges. As we wrap up this episode, I encourage you to take action. If you found this information valuable, consider enrolling in Therapy Training's course on Pediatric Abusive Head Trauma. This course goes deeper into the subject and will equip you with the tools you need to effectively address and prevent abusive head trauma in your practice. Visit therapytrainings.com to find this course and explore other valuable resources that can enhance your professional development. Remember, knowledge is power, and by equipping ourselves with the right tools, we can fight against child abuse and create safer communities for all children. Thank you for tuning in today. Let's continue to learn, advocate, and strive for a world where every child is protected and cherished. Until next time, take care of yourselves and each other.